Hello everyone, I'm Zhang Qian, a master's student from Huaxin Magnetic Resonance Research Center. My presentation is titled Cognition-related subcortical connectome gradient dysfunction in major depressive disorder. Subcortical functional abnormalities are believed to contribute to clinical symptoms and cognitive impairments in major depressive disorder. While significant progress has been made in characterizing discrete large-scale functional network alterations in MDD, alterations in the continuous spatial patterns of interregion connectivity remain less well understood, particularly the nature and role of alterations in subcortical function. The novel gradient-based approach provides a promising way to identify the subcortical functional hierarchies by representing the high-dimensional functional connectome in a set of low-dimensional gradients based on their similarity in functional connectivity patterns. Unlike the traditional functional connectivity analysis and graph theory approaches, which primarily focusing on the pairwise correlations and network properties, gradients can capture more gradual changes in the connectivity patterns and depict the overarching spatial relationships of the interregional connectivity across the brain. Previous studies using this framework have demonstrated a principal sensorimotor to transmodal gradient of cortical organization in MDD patients, and these gradient alterations were further found to be related to sensory processing and higher-order cognition in MDD. However, to the best of our knowledge, no study on subcortical-cortical gradients in MDD has been reported. Thus, we aim to characterize the gradient alterations of the subcortical-cortical connectome, which may help us gain further insight into pathophysiological mechanism of MDD and determine their role in disturbances of cognition. In the present study, resting state fMRI data were collected from 145 drug-naive first-episode MDD patients and 145 age and gender-matched healthy controls. 3 MDD-related cognitive domains were assessed by using the neuropsychological tests of episodic memory, attention and processing speed, and executive function. Here is the flowchart of the gradient-based approach. For each participant, we first constructed the functional connectome by correlating the time courses of each subcortical and cortical voxel. The functional connectome was then decomposed into 10 gradients using the normalized angle kernel function and diffusion embedding approach in the brain space toolbox. Each gradient is an axis capturing the variance in connectivity similarity across the subcortical voxels. In our study, we mainly focused on the first one, which is the principal gradient, as it explained most of the variance. The degree of connectivity similarity and the relative spatial perception of each subcortical voxel along the principal gradient were represented by the principal gradient values. Furthermore, previous evidence has highlighted the essential roles of the thalamocortical circuits in the cognitive functioning and MDD pathology. To further investigate the gradient architecture in thalamic subregions linked to specific cortical functional networks, we defined a thalamic functional atlas through thalamocortical functional connectivity analysis. Based on Tian's subcortical atlas and You's cortical atlas, correlation analyses were performed between the time course of each thalamic voxel and the average time course of each cortical network for each participant. By employing the winner-take-all parcellation approach, each thalamic voxel was labeled according to the cortical network with the maximum correlation coefficient. Notably, the limbic network was excluded from the parcellation process due to its susceptibility artifacts, thus resulting in 6 thalamic subregions. Then we extracted the principal gradient values at different spatial levels for further investigation. At the global level, two-sample KS test was applied to compare the global spatial distributions of the principal gradient values. Then we parcellated the subcortical structures into limbic, thalamic, and basal ganglia systems and 16 subregions based on Qian subcortical atlas. Between-group comparisons were conducted using the paired t-tests in the system and subregion levels, as well as in the thalamic functional subregions. We also performed correlation analysis to assess the associations between the significant gradient alterations and clinical and cognitive features in MDD. We found that, at the global level, MDD patients showed a contracted range of the global principal gradient values compared to healthy controls. The brain maps showed a gradual medial to lateral transition of the principal gradient values in the MDD group, while an anterior to posterior transition was observed in healthy controls. At the system level, MDD patients showed significantly decreased gradient values in the limbic system and thalamus, but increased gradient values in the basal ganglia in comparison with healthy controls. The transition patterns of the principal gradient values within each system also differed between groups. As shown in the figure above, across the 6 thalamic functional subregions, the principal gradient values showed a gradual transition from the subregions corresponding to the visual sensorimotor networks to attention and default mode network, with MDD group showing relatively higher values in the thalamic subregions related to frontal parietal network, but lower in other subregions. Moreover, we also found that the gradient values of the thalamus and its functional subregion projecting to the default mode network showed positive associations with the episodic memory performance in MDD patients. In conclusion, by utilizing the gradient-based decomposition approach, we identified multi-scale gradient alterations in MDD patients relative to healthy controls in the subcortical-cortical connectome, which reflected the underlying changes in the functional properties and spatial architecture. We also highlighted the role of the thalamic gradient alterations in MDD-related cognitive impairments. Overall, our findings revealed an internally differentiated and clinically relevant pattern of the subcortical gradient dysfunction in MDD. That's all for my presentation. Thanks for your time and attention.